Welcome to India TV. I'm Anshu Jaising and you're watching HealthDNA. And today with us we have Dr Durgatosh Pandey, Chief Surgical Oncology, Manipal Hospital. Welcome, sir. Welcome, sir.
Thank you.
Sir, what is breast cancer?
So, cancer is an unregulated proliferation of cells in any part of the body. And if it happens in breast, it is called a breast cancer. And it is now one of the commonest cancers which we see in women. So that's it, the breast cancer.
So what are the common signs and symptoms? Also, how to differentiate whether it's benign or cyst?
So unfortunately, there is no specific signs or symptoms that is indicates that this lump is a breast cancer and this one is a benign disease. About 50% of women within their reproductive age group, which means between 15 and 50, will have some kind of a breast lump at some point of time. In these many years. Now, many of those breast lumps are not discrete. If we find a discrete lump, then it becomes a little suspicious. There is a lumpiness in the breast that is not so much suspicious. Younger the age, the suspicion to us is lesser, especially if the lump is not discrete. In elderly individuals, the suspicion is more. Unfortunately, in India, we have 50% of breast cancer that happens before 50.
So when should someone seek medical attention?
For any thing which is related to health, any unexplained illness. For breast, we say that any lump in the breast which is there for more than a month or so, which is unexplained. If suppose there is a woman who has a pain in the breast along with some kind of a lumpiness which happens in the mid part of her menstrual cycle every month, that's not so suspicious. That's a routine thing which is happening. But something which is out of routine and there is a lump in the breast which has come, especially if it is painless, because breast cancer is notorious for being painless and therefore it is missed by a lot of individuals. These things should be reported if the lump is for more than a year or so. Another thing, if there is an unexplained discharge from the nipple, especially if it is bloody. If there is an ulceration in the nipple which is unexplained, nipple has got inverted. In some women, the inversion of nipple is a phenomenon by birth. But in certain women, the nipple inversion is a recent phenomenon. That indicates that there is something which is pulling the nipple back.
Correct.
And these things should be reported to the doctor and the woman should get investigated.
Yes, sir. So what are the risk factors associated with breast cancer? So
breast cancer, being a woman itself is a risk factor for a breast cancer because more than 98% of all breast cancer happen in women, which means that about 1 to 2% breast cancer also happens in men because of their glandular breast tissue. Now within women, there are some risk factors which we say, being obese, the lifestyle factors, high fatty diet, overweight, lack of exercise, sedentary body habits. These are risk factors for developing certain cancers and especially breast cancer. Other than that, there are certain things, these are things which I said are modifiable, that a woman has control on. She can exercise, she can reduce her weight. So these are modifiable factors. There are certain non-modifiable factors, like we say age of menarche. The longer the reproductive age group, which means earlier menarche, later menopause. These are people who are at a little higher risk of breast cancer. So this is about it. Having no child, no issue is another risk factor for breast cancer. So women who have more children have a slightly lower risk of breast cancer than women who do not have children. So these are the risk factors that we talk about.
So after the age of 40, how often should women go and get themselves, or women should get themselves screened, and what are the screening methods? Are there any limitations or benefits of these screening methods?
So because breast cancer is an important public health problem, it's the commonest cancer in women. So naturally, the next question is, can we detect these breast cancers at an earlier stage or even in a pre-invasive stage? So there comes the screening. So if we look at the recommendations of screening, there are several recommendations of screening, and the recommendations would say that after the age of 40, so between 40 and 50, the woman should have a screening mammogram done every 2 years, and after 50 it should be annual mammogram done for women after 50. This is a Western recommendation which we also have followed. It has got a lot of limitations. In the first limitation is it practical to adopt it in our country? Even in the West, where the population is affluent, they are struggling to implement this strategy of an annual mammogram after 50. This is the first limitation, how to go about in a widespread population. The second limitation is one has to look at it scientifically. Is it really that effective?
Correct.
Now, if we look at a mammogram, for every breast cancer that it detects, it detects certain suspicious lesions, 2 or 3 more suspicious lesions for every breast cancer that it will detect, which means that these people who do not have actually breast cancer and have certain suspicious lesions would go for biopsies. So we increase the investigations, we increase the cost, and then we detect one breast cancer which might have been detected if the woman was a little more vigilant about her body. So my recommendation to all women would be that if you could get screening done, go ahead and do it every 2 years after between 40 and 50, and every year after 50. But at least be vigilant about your own body. If there is an unexplained lump in the breast, please do not hesitate and go to your doctor. That doctor would investigate you. There we call it a triple test that we do: a clinical examination, an imaging study, which may be a mammogram or an ultrasound, and a biopsy or an FNAC. These triple tests would tell us whether the lump is benign or malignant.
So what are the different stages of breast cancer, and are there, different treatments for these stages, or, as we go to the later stage, does the treatment vary?
So almost all cancers have been staged from stage 1 to stage 4, and so is breast cancer. Breast cancer would be stage 1 to stage 4, and as the name indicates, it would be a lesser aggressive stage to a more aggressive stage. It depends on how big is the tumor, how has it infiltrated into the skin, has it ulcerated into the skin or to the muscles in the chest wall. Now these are tumor characteristics. Then there are lymph nodes to which it spreads. The lymph nodes are in the armpits or in the neck. So these are the lymph nodes that we see. They are also sometimes within the chest. Then we see whether it has gone to any distant organ or not. That cancer may go to the liver, to the bone, to the brain, to the lungs, etc. Now, according to this, the stages have been defined, and it is from stage 1 to stage 4. Naturally, the prognosis of stage 1 disease is much better than that of stage 4 disease. The treatment options, the curative options are much more. If we look at stage 1 and 2 disease combined, the chances of cure that a patient has with a breast cancers between stage 1 and stage 2 is around 80%. 80% patients can get cured. If we look at stage 3 and stage 4 combined, that percentage drops to less than 40%, about 30 to 40%.
So if I ask you, how common is breast cancer in Indian women?
So in Indian women, if we look at the entire data within India, about 25.8, if I remember correctly, per 100,000 population. This is the breast cancer burden, the incidence of breast cancer in Indian women, 25.8 per 100,000. Now, is it uniformly distributed? No. If we look in Delhi, it is 41.
Okay.
About 41. Now, mind you, half of these patients will die. If the incidence is 25.8 per 100,000, the mortality is just about half, 12.7 or 12.8, about that much. Same thing goes on city to city. In Delhi, it is the highest, 41, followed by, I think it's Chennai or Bangalore, it's about 37. So, if we look at the tier 1 cities, the metropolitan cities, where the modern lifestyle is there, the food habits have changed, we have adopted Western habits, the incidence of breast cancer has also increased.
So, can you explain the role of genetics, and if somebody has history of breast cancer, how can that person prevent it? How can that woman prevent it?
So there is a role of genetics in breast cancer as well. When I say genetics, I think you mean hereditary thing, because all cancers are genetic, in the sense that there has to be a genetic mutation for a cancer to take place, but not necessarily hereditary. Hereditary means from family, running in family. Now, if there are 3 first-degree relatives that have had breast cancer or an ovarian cancer, such women are at a statistically higher chances of developing breast or ovarian cancers. So this is a subjective explanation that we do. So we find such women, if there are such women who approach us that 2 or 3 of their first degree relatives have had breast cancer or ovarian cancer, especially at a younger age. Younger age means age before 50. In such women, we can do certain genetic testings to see if they are actually at a higher risk of breast cancer. There is a full gamut of genetic counseling that happens, because if you find something, you have to offer certain things. The woman must know what she is going through. So if a woman elects to have that kind of a genetic screening, then we ask for BRCA, which we call BRCA1 and BRCA2 genes expression. So if these genes are mutant in that woman, then that woman has a 70% chance of developing breast cancer and 50% chance of developing ovarian cancer in future, at some point of time in her life. Now, a woman may elect not to get such test done because this creates a lot of fear in their mind. So in such women, screening is emphasized. So such women must undergo screening regularly, not just for breast cancer, but also for ovarian cancer. Not just that woman, but the family members also. This applies to the family members also.
So what are the treatments for breast cancer?
Broadly, the treatment is classified into surgical treatment, treatment by chemotherapy, hormonal therapy, immunotherapy, targeted therapy. These are all systemic therapies which go into the blood. The surgical treatment is a local treatment, and radiotherapy. So broadly, there are 3 modalities of treatment. One is surgery, radiotherapy, these are local treatments, and there is a systemic therapy which is for the entire body. Surgical resection is more or less limited to the local disease, which means when we are talking about stage 1, 2 and 3, there comes surgery at some point of time. Radiotherapy, same. The chemotherapy will be more for the advanced diseases and also for earlier diseases as a part of the multimodality treatment with surgery and radiotherapy.
So what about the side effects, and do you think these side effects can be managed?
So we have to go one step at a time. We have to discuss the side effects of surgery, radiotherapy, chemotherapy, etc. So if we talk about surgery, previously the standard treatment for a breast cancer used to be mastectomy, removal of the breast.
Correct.
So that would have a tremendous psychological side effect to the lady. Now, with the women coming to us at an earlier stage, the surgical, the advances in surgical techniques, as well as the advances in the surgical knowledge, the knowledge about the disease factor itself. In many patients, we can actually preserve the breast.
Okay.
In our center, for example, we do breast cancer surgeries. Among all the breast cancer surgeries, more than 50 to 60% are breast conservation surgeries. So the woman can conserve the breast even if she have a breast cancer.
So it depends on early detection.
Yes. The second thing is about the lymph nodes. If we remove the lymph nodes and we also give radiotherapy, the chances of developing lymphedema, which means the swelling of the arm, of that side of the arm, is quite high. It is in the tune of about 10%. Now that chance of lymphedema can be decreased, the swelling of the arm can be decreased by following a thing which is called a sentinel node biopsy. If we see that there are no palpable lymph nodes, we cannot feel any lymph nodes, then there are techniques to examine the single node which we call a policeman node, with the first node, the sentinel. And we remove that node, we subject it for a pathological examination. If that is negative, then we do not do a lymph node dissection and that woman is spared of that complication of surgery. So this is about surgery. The radiotherapy, more or less, the complications are minimized by the modern techniques. Previously, there were lung complications, cardiac complications of radiotherapy. Now, with the modern techniques, more or less, the side effects are local and they are temporary. Those eczematous reaction to the skin, etc. When we come to chemotherapy, the side effects are more diverse. The drug which is given very often for breast cancer causes hair loss in women. That again has a negative connotation as far as the psychological effect is concerned. The good part is that this hair loss is temporary. Once the treatment is over, that hair will again come back. But this is certainly a problem. Other than that, there are other factors related to suppression of immunity, the reduction of counts because of the bone marrow toxicity, etc.
So talking about the emotional and psychological aspect of it, how can a woman advocate for herself and have that kind of a surrounding? How important it is?
It is extremely important because any cancer, and especially breast cancer, whenever I see a patient with breast cancer or for that matter any cancer, I tell the woman as well as the family members that you have to take out 7 to 8 months of your family life, which means that 7 to 8 months of the time you have to take it off for the treatment to happen well. Those 7-8 months are extremely important. This will have surgery, this will have chemotherapy, radiotherapy, etc. Other than the physical side effects and complications which we can manage actually, the important problems are psychological, and the family has to be extremely understanding in order to encourage the woman to get into the treatment in a more positive fashion so that the results are better. So the family support is extremely important, and so is the woman's own confidence. We have seen that when the woman initiates the treatment, they are often very scared and they have a lot of negative thoughts. But once they get into the treatment, generally everything stabilizes, especially if the family support is good.
So, what all lifestyle changes can we make in order to prevent ourselves from getting breast cancer? Do you think that would help?
So, as I said, there are modifiable factors. So, there are factors which we cannot modify. We cannot modify the genetics and the hereditary composition that we have.
Correct.
But what we can modify are the factors that we can change, that is in our hands. Do not lead a sedentary lifestyle. Exercise, moderation in eating. If someone is overweight or obese, try to lose weight. Be aware of your own body. If there is a lump, go to the doctor quickly. Because even if we cannot prevent a breast cancer, it is important to detect that breast cancer at an earlier stage so that we can provide a better outcome to that patient. And the junk food, etc., these things are also important as far as the prevention of breast cancer is concerned.
So what would you like to say when we talk about the importance of breast health? How important is breast health, and why it is important to create awareness about breast cancer?
So when we used to talk about breast health in the past, most often it would mean lactation.
Correct.
So and lactation, by the way, has a protective effect on breast cancer. So a woman who has had babies, have breastfed those babies, they are at a lesser risk of having breast cancer. Having said that, the incidence is so common that even those women will get some degree of breast cancer. So take care of your breast. There is a very well-defined technique of breast self-examination, which you can get those breast self-examination in any online model. One can see that. And if the woman does a breast self-examination once in 3 months or 6 months or so, they are more likely to detect their own lumps in a more efficient manner. And if a lump is detected, and if it is for more than a month or so, go to a doctor. That is the thing which I would advocate. And screening, especially if the woman is at a higher risk. Screening means mammogram every 2 years between 40 and 50, and annual mammogram after 50.
Thank you so much, sir, for joining us. It was really a pleasure talking to you. Thank you so much for joining us.
Thank you.